Hello and welcome to Artist Media Network, Artist TV's weekly program Talk to Artists, and I'm Gamachi Samandida bringing the program to you. Today we are situated at Juma University and we'll be talking about community-based education, and we'll be joined by Professor Dr. Engineer Isaias Alamayo, who is the Director of the Community-Based Education Program at Juma University. Stay with us. Professor Dr. Engineer Isaias Alamayo, welcome to our program.
Thank you.
What's meant by community-based education in general?
Community-based education is an educational philosophy of the higher education institutes. As you know, the primary aim of this higher education institute is to assist societal need and also to improve community development. So, as we always say, education is a means for national development and economic growth. To this effect, the universities have responsibility to produce competent educationals through appropriate educational philosophy.
What makes community-based education at Juma University unique?
That's a very important question. Well, you know, Juma University adopts this community-based education at the right of the inceptions, which means in 1983, at the time of Juma Institute of Health Science, and implemented for the last 4 decades this educational philosophy. So community-based education is a very unique educational philosophy in Juma University because it has very special 5 key features. These 5 key features, the first one is Juma University educational philosophy has strategies to implement community-based education. In this strategy, there are 3 important programs. One, we call it community-based training program, which is usually adopted for undergraduate students. It starts from first year and end into graduating year. It has spiral nature. And the second one is, we call it student research project. Every Juma University student, before they graduate, they have to conduct independent research. That is the second strategy. And the third strategy, we call it team training program. For postgraduate, we call it developmental team training program. So this team training program is mainly designed for health students and also biomedical engineering students. The student deployed in the health center for 2 months, and they do the real jobs and supporting the community. So one unique features of community-based education in Juma University is because of the strategy. The second important is this community-based education differs from the other because of the principle. It has a unique principle. Here also we can raise 3 important essential elements. The first one is, as I said, this program carried out in the university in the form of spiral nature. We call it N-1 principle. So every student, whether PG or UG, should engage with community-based training program or community-based education in general, and starting from first year. So it has spiral nature. Every year after the class, the student need to go to the community, not only the student, but the staff also. And they do proper kinds of activity. The second principle is those community-based educations in general is follow problem-solving steps, which means it starts from identifying the problem and up to intervention and evaluation. The third important principle is real. So this is the second key. The third key, what makes unique Juma University community-based education as an educational philosophy has 3 important features as well. One, I call it, usually we call it empowerment. When you go to the community, we are not just supporting the community like donors. We like to empower them. We show them the resource in a different discipline. And they have to be part of also the plan. So empowerment should be there. In addition to empowerment, there is innovation and partnership. We are not doing business as usual. When the community goes there, they should have to come up with some innovation element, with a value. Anything what they do, they should have to give a values. And we are doing this activity with partnership. So this is the third key. The fourth key, what makes unique This educational philosophy implemented in all three pillars. As you know, universities have three pillars: academic, research, and service. So community-based education embedded in academic, in training, in research, and service. The last important key for community-based education is any activity, any training, any research, what we are doing through this community-based education should bring an important positive impact on the three domains: cognitive, the psychomotors, and the affective, the knowledge, the skill, and the attitude. That's why CBE is unique, or community-based education is unique educational philosophy in Jimma University, which you cannot get in other universities.
What have you accomplished in your community-based education program so far?
Community-based education already adopted for the last 4 decades, 40 years, which means, this is educational philosophy, adopted very well in Jimma University. So if you look at our graduates, we do have more than 120,000 graduates in a different discipline. They all pass through community-based education. So these professionals already have internalized community-based education, and they cultivate, these 21st century skills. So that's one of our achievement is we produce professionals who have better understandings of the issue of the community. And the second important thing is we have developed a number of guidelines with regard to community-based to adopt with other universities. Already some other universities emulated this philosophy, and they are trying to use also. We have guidelines, we have manuals, and we have a proper kind of directives to implement this community-based education. And we have served also local communities in a different scale, or through developmental team training programs. Through TTP, for example, if you look at, we have 8 different centers, health centers, that our professional, our student, instructor deployed for 2 months to serve the community. So our community is getting also a service. That is one of the accomplishments what we have in development and team training program. As I said, in Jimma City and some other city, we have done a number of interventions, particularly water and sanitation, in agricultural and construction activities, that we accomplished a lot, and still those things are functional and benefiting the community. And also through student research projects, we have produced very important good ideas, are very competitive. Our students even go to competitions in US universities, the student at the US level, and they got the third rank. That's, comparing with those universities. There are tremendous achievements in a different discipline through this community-based education.
What challenges have you encountered so far while you implement community-based education program here at your university?
Well, I should have to say, this community-based education, even if there are a lot of achievement, but there are challenges also. The challenge, I should say, the number of students, increasing student number is one of the challenges to implement. When we established this philosophy, the total number of students is less than 700 in Jimma University, but now more than 40,000 students. So when the number of students increased, especially in undergraduate, and without having proper adequate resource, you can imagine what type of challenge, what we have, practical challenge. And there is a challenge in resource aspect, especially the budget issues, facility, transportation, because community-based education is implemented in a local community within 100-kilometer radius. So the students need to deploy in these 100 kilometers, and they should come back, so we need more transportation vehicles. That's one of the challenge. And of course, there is also community fatigue nowadays. Community fatigue is, the students since 1983 in Gregorian calendar, the students are deploying in the same communities. So when they go always and then to that community without having a very strong intervention and asking questions and collecting a different information from the community, that really creates the fatigue, especially on community-based training program. We don't have community fatigue, for example, in team training program, in developmental team training program. And another challenge also, the misunderstanding of this philosophy, especially new staff, new students, because the senior already gone. Some of the founders not really alive, sorry for that. And some of them also transfer in other university because of several reasons. So when the senior move, the young, the junior instructors and the newcomer students, they a little bit misunderstood what community-based education is. So this is creating a challenge in implementation. So these are some of the challenges what we have.
What measures have you taken in order to cope up with the challenges?
Yeah, we tried a number of strategy to overcome the challenge. The first thing, we try to innovate the community-based education philosophies. We want to transfer the conventional community-based education into 21st century community-based education. You know, the conventional, that what we practice the last 40 years, there is no problem for that. Still it works. But you know, because of several change now, after 40 years, so we like to innovate the philosophy by establishing community-based education innovation center. We are now trying to establish this innovation center. We have already included in our 10-year strategic plan, which is 2021 up to 2030. This innovation center has three important components. One, knowledge management center. When you have knowledge management center, so the knowledge can be transferred properly. It could be documented and utilized by the researcher, by the young staff. That can reduce the misunderstanding and the chaos of this community-based education philosophy. In this center, we would like to establish also galleries, the indoor and outdoor galleries. The indoor gallery within the campus, we have already started some activities. The outdoor galleries, creating community-based education village, community-based education schools. These are model schools. So the other can easily get better information, practical information. So we also trying to come up with different models of community-based education. For example, we have CBE therapy. CBE stands community-based education therapy, which means giving training for the new staffs. Induction, when any staff employed in Jimma University, you want to give induction for them to understand this philosophy. This is, we call it CBE therapy. We have started also CBE exchange now. The CBE exchange, more of internationalization and partnership to get funders. For example, in the first decade, the first 10 years when we established CBE, it was highly supported by Irish government, huge monies. And that really makes easy to execute Jimma University in proper ways, those strategies. So we are trying now, we developed already a proposal to attract the funders, the embassies who are working in educational philosophies and getting such support that minimize the resource issues. With regard to community fatigue, we come up now plus CBE. Plus is stand for C. So when you say community, it's not only local community. We need to have national communities at country levels. We are trying international communities. This is work now. So to avoid the fatigues, we are now expanding also the community size. By the way, we have done developmental team training program in Addis Ababa, for example, via the local university. There are a lot of water sanitations intervention like latrines and water facilities were properly constructed in Addis. We have been working in Hargeisa. We have a campus in Hargeisa also, Somaliland. And when we say communities, now because of this 21st century, it's not only local, digital community, online communities. We have now students from US, Rice University, dedicated only with the philosophy. We do have the university students from other European countries, from Belgium, Netherlands, even Germany. We are doing a number of mechanisms to overcome the challenge, and I'm sure this help a lot to intervene some on the challenge.
How is it different from the one we find elsewhere? Because people talk about it in other universities, this community-based service, community-based research. I hear of them.
In Ethiopia, we are nationally pioneer. In 1983 is the first time that at the time of Jimma Institute of Health Science Institutes adopt this community-based education. We are not just importing, but we made it here. You will not find in another university JU brand kind of community-based education. With those three strategies and with those three pillars, with those three features, and with those proper kinds of achievement, that exists in Jimma University. Nowadays, there are many universities are also adopting community-based education partly. Some of the universities, they have, for example, one of the strategy, team training program. For example, team training program, by the way, Gondar University is pioneer with team approach than Jimma University. But Jimma University, the overall CBE, we are nationally pioneer. Addis Ababa University or other universities, there are still some elements of doing community-based activity, especially young generation universities, second, third generations. Many of them, they are graduated from Jimma University also. They took this philosophy and they are trying to implement it. But the problem is, it's not running the program, embedding with academy. What does it mean? When you design the curriculum, every year, the courses what you already put in your curriculum, once they have the classroom teaching, they should have to take these courses to the community and they have to practice, because CBE is making the community as a learning environment. In not only CBTP, when you go to developmental team training program, number of mixed professionals, they go to the community as a Warada model. Engineers, the health professional, the educationists, the professional from law department. They go together to the community, like Warada model, and they start to work by identifying the problem together with the communities and come up with prioritization and then start intervention. So as a geo-brand educational philosophy, we are nationally pioneer, but nowadays number of universities already adopted this one and they are starting to practice community-based education.
Who are beneficiaries of a community-based education program?
Well, the major beneficiaries are the three groups: the student, instructor, and the community. The student, when they pass through community-based education, they are not just ordinary students. They understood the community. They better capture the felt needs of the community. They do all problem-solving steps. They have positive attitudes. They develop positive attitudes to the community, and they benefit a lot. They know how to exercise that specific course. The instructor, when they go there, they are not like a boss. They learn a lot. They are indigenous knowledge from the communities. You know that. There are a number of indigenous knowledge. Community member will tell you. So that could be a good forum for instructors to pick research ideas and for the future career. The community, of course, they part of this system. There are a lot of intervention. The problems, the burning problems, can be solved together with the community. So what the measures are these three. And the others, I should have to say, the overall, the higher education system, because having such indigenous Ethiopian-made, Jew-made kind of educational philosophy is really a lot for higher educations, isn't it? Because nowadays you can give better knowledge, some skill, but attitude part is not well captured in my view. So CB can do that by bringing the student and the staff to the real community. So the higher educations and the other sectors, of course, depending on the programs, are our beneficiary.
Now let's come to the impacts you've made on people's lives. Would you tell us about them, please?
Yeah, that's really a good question, and we raise this question also while discussing community-based education, because 40 years, 4 decades is a lot. And then at the middle of this 40 years, I mean around 20 years experience of community-based education, we try to measure the impact. We conducted impact assessment. We took 2 waradas. Yeah, one is community-based education warada, we call it CB warada. Another one is non-CB warada around Jimma zone, in Jimma surrounding. And we try to measure the educational aspect, the agricultural productivity, the economic aspect, the health issues into this warada. One is with CB, another one is without CB. Surprisingly, we have got a very attractive and significant results that really differentiate these 2 waradas. To tell you one important data, in 2004, it's already published, we try to measure infant mortality rate. Infant mortality rate is number of days per 1,000 live births. That's the proper indication globally. In these 2 warada, in non-CB warada, we have gotten 128.2 per thousands of days. That's a lot. Infant mortality is high. When you come to CB warada, that we intervene, sending our student and sending our instructor, it dramatically reduced to 96 per 1,000. Well, this is not as such, comparing in general, it's not significant, but comparing to CB and non-CB warada, we try to see a significant impact. That's one example. And again, one of the impact is currently, because of the CB, we have established field research center. We call it Gilgil Gibe Field Research Center. Number of policies are now producing a relation with water, agriculture, and health. This center is established just 50 kilometers from Jimma University. The centers are a lot of impact for our PhD students, for scientists, and for the communities. We're measuring all events with there. In 2014, we made also graduate tracer study at the countrywide. And we went to the east, west, south, and north part of Ethiopia, and we tried to see where are our graduates, what impact they produce, and what the other beneficiaries said about our graduate, and comparing to the other graduate. That we found that this is just research-based data. We found a very significant result. 85 and above % of the 21st century, skills is highly cultivated because of community-based education. Our graduates are, the employers are very proud with our graduates, and we checked all those elements there, and there are huge impacts, significant impacts that what we produce for CB.
Who are your stakeholders and how do you describe their roles in supporting your efforts?
Yeah, that's really a good question. Our stakeholders, if you look at the large scale, we are running almost all disciplines now. So in any aspect, agriculture, health, engineering, constructions, those at ministry level, government, non-government organizations, they are all our stakeholders. So we do have a very good response from them. They are really highly committed, especially with some of our strategy, like developmental team training program. There are a lot of applications. The communities are willing to take our students and the staff in team training program. As I said, 8 health centers. When the students are there two months, the number of patients also increasing, because everybody will come to the health center because of adequate health profile. When they go out from that, we measure that also. Number of patient services also decline. So those are our stakeholders. They are supporting, they are eager for us. So this Ministry of Education and other educational sectors are really very relevant stakeholders for us, and we're expecting a lot from them to adopt this educational philosophy and give us a proper support, at least to make the academic calendar a bit flexible for GMA universities, and considering our philosophy in a different aspect, including the budget aspect.
Viewers, thank you very much for watching our program. And in today's program, we've been talking with Professor Dr. Engineer Isaias Alamayo.